For over 100 years, the people of our region have known where to turn for exceptional, compassionate health care. The dedicated and professional care rendered by the Sisters of Mary of the Presentation in North Dakota and Central Illinois over the years is still available today. From a modern Sisters of Mary of the Presentation health system, commonly known as SMP health system, which is dedicated to giving patients quality medical care close to their home. Founded in France in 1828 by two sisters, Louise and Laurence Lemarchand, the Sisters of Mary of the Presentation is an historic international religious community. Their ministry was to serve the underserved, to teach the children who had no religious instruction, to care for the sick, the disabled, and the elderly. The congregation grew and thrived throughout France, and in the spring of 1903 opened its first hospital in the United States, St. Margaret's Health in Spring Valley, Illinois. More hospitals followed with the opening of 3 more in North Dakota from 1913 to 1940. Home health services were started as a hospital department and eventually grew into Prairieland Home Care in 1977. The sisters would expand their healthcare mission with the purchase of 5 nursing homes from Banner Health System in April 2002. With the advent of Medicare in the 1960s, the life and the operation of hospitals became more complex, and the sisters looked outside the order and hired lay administrators to help manage its healthcare mission. They created the SMP Central Management Corporation, which later became SMP Health System in 2000.
The sisters' original mission of healing, which began over a century ago, still continues today. The SMP health system that serves that mission, however, has grown substantially.
It consists of 10 different healthcare operations, 4 hospitals, 1 in Spring Valley, Illinois, St. Margaret's Health, and 3 in North Dakota, St. Andrew's Health Center in Bottineau, St. Aloysius Medical Center in Harvey, which also includes a co-located long-term care operation, and Presentation Medical Center in Rolla. SMP Health System also has 5 long-term care facilities in North Dakota as well: Ave Maria Village in Jamestown, Cheyenne Care Center in Valley City, Mary Hill Manor in Enderlin, Rosewood on Broadway and Villa Maria in Fargo, and Prairieland Home Care in Spring Valley, Illinois.
Doctors, surgeons, nurses, and medical support staff at our hospitals treat patients with advanced methods and technology while providing compassionate and personal care.
From 24-hour emergency room service at all of their medical centers and on-premise physical therapy at all of their long-term care facilities to home care services by Prairieland Home Care, SMP Health System sees to it that every patient is cared for by expert personnel formed in the spirit of the Sisters of Mary of the Presentation and trained in the most current healthcare industry best practices.
Decision-making at every SMP health system facility is guided by the ethical and religious directives for Catholic healthcare, as well as state and federal healthcare guidelines. We strive to see that each individual receives appropriate and holistic treatment, and that his or her rights are protected while in our care.
Deep, compassionate respect for the uniqueness of each person in our care. That is the mission of the SMP Health System Healthcare Ministries. Yes, ministries. That's what we call our various operations. Be it home health, hospital, or long-term care, all of our work is a ministry. Everyone at SMP Health System works day in and day out to fulfill the healing mission of Jesus by ministering to our residents and patients' physical, spiritual, psychological, and emotional needs, just as the founding Sisters of Mary the Presentation did so long ago. Our day-to-day operational values embrace 4 main principles in order to fulfill the healing mission of Jesus. Healing hospitality. We seek healing for the whole person, emotional, spiritual, social, and physical. Integrity. We are morally committed to our mission and to truth, quality, and professionalism. Stewardship. We use responsibly our God-given gifts of human and material resources as we develop them for the benefit of the whole community. Service. We're accountable to God and the church for promoting an atmosphere of loving care as we serve the common good of our communities and one another.
Although the system has grown and healthcare technology has advanced and changed, one thing will never change. The people of our region will always know where to turn for exceptional, compassionate healthcare. The dedicated and loving care of the early Sisters of Mary of the Presentation is still available today from a modern SMP health system which is dedicated to providing quality medical service close to home.